Every woman changes from a girl into a woman. No one should feel ashamed of any part of his or her body. A woman's body is like a tree. When she matures, she is ready to bear fruit.
See, the woman's body has one uterus and two ovaries, and each month from one of the ovaries one egg is formed. As the egg is maturing, at the same time the lining of the uterus also goes on maturing, and by the time the egg is ready to be released, the lining of the uterus is ready to receive the egg if it gets fertilized, so that the fertilized egg can get implanted in the uterus and then grow into a baby. So the initial nourishment of this fertilized egg is the function of this lining of the uterus. But if fertilization does not occur, and if a baby is not being formed, then this lining of the uterus becomes useless and it is shed at the end of the menstrual cycle as altered blood mixed with some mucus and mixed with the lining of the uterus. This period of where blood and mixed with some of the tissues comes out, this time is called menstruation actually. The other thing is about how frequently the menstrual pad or cloth used for absorbing the menstrual blood should be changed. One thing is that it should be changed as soon as it is fully soaked, or at least every 8 hours. The pad taken at night should be changed early in the next morning. So even if it is not fully soaked, it should not be kept for the whole day, because then bacteria can grow in this blood and then it starts to smell, and it can cause different infections as well. See, many girls are shy and try to dispose of it secretly by flushing it in the toilet. The other practice that I find is that sanitary napkins are just thrown on the roads, where they are sometimes picked up by dogs, and they are very unaesthetic to look at and can also spread diseases as this blood can get infected. See, all the medications that are used for postponing or preponing the menstrual periods are actually high doses of hormones. These hormones do have side effects, some of which can be very serious. Now, I find that girls and women are not at all reluctant to take these high doses of hormones, even repeatedly, even for very flimsy things like a friend's wedding or some function in the house. Now, repeatedly taking these pills for postponing or preponing the periods can have side effects on the menstrual regularity, plus the pills themselves have their own side effects, including clotting of blood in the veins, which can have very disastrous consequences. So as a doctor, I do not recommend postponing or preponing menstruations for small flimsy reasons.